cancers, various cancers, and treatment of cancer can have and do have symptoms that we certainly see. There are many different that we see depending upon the type of treatment, but they can be things like fatigue, nausea, vomiting, diarrhea. So maybe thinking about fatigue, for example, we know that more than 90% of patients with cancer and who are treated for cancer have fatigue. So what are some general things that we can do to help to relieve and prevent fatigue? The 4 things I like to focus on as an initial step are going to be hydration. A lot of people don't think about dehydration causing fatigue, but it's one of the most common causes. So in general, we're advocating 2 to 3 liters, about 2 to 3 quarts, or 64 to 96 ounces of fluid per day. So focusing on hydration is very, very important. Other things, eating a healthy, balanced diet. Now, depending upon your personal situation, you may receive specific recommendations from your oncologist. There's no perfect diet for cancer patients. I wish there was. It would make our job easier. But the best studied diet for cancer patients is a Mediterranean diet, which is high in fruits, vegetables, whole grains, lean proteins, and really trying to limit highly processed foods. Sleep. Getting adequate sleep is very, very important. So usually we're advocating for at least 7 to 8 hours of sleep per night if possible. If you're struggling with sleep, it's very important to talk to your oncologist because there are many different things that we can potentially do to help, both lifestyle interventions and also, if necessary, medication. The last thing is very important, which is exercise. Now, again, depending on your particular situation, you may have specific recommendations from your oncologist. We're not necessarily talking about very strenuous exercise here. We're just talking about getting up and moving, which is very, very important. So make sure you're communicating with your oncologist about any recommendations they have. But we know that patients who are sedentary and don't move have worse quality of life, they have more fatigue, and they do worse with treatment and side effects in general.